Continuing in our series on medication non-adherence, I'd like to speak about something very important today, and that is the effect of denial. Now, denial has been described as a psychological defense mechanism whereby someone would be faced with a particular fact. So let's just say this is the patient here, and the patient has been presented with a new diagnosis. But the patient feels unable to accept this fact. So there's a fact in front of them, but for some or other reason they're not ready to accept this fact. And psychologically they reject it and they go into denial. Now, when we think of denial, we must realize that it is not just all one single thing. It can be very mild and actually be helpful. As we said, it's a defense mechanism that also helps each one of us protect ourselves against the overwhelming amount of bad news that we face every day. We cannot deal with every bad thing that happens in the world or that we see on the news. So we move these things from our conscious to our subconscious or out of our consciousness in order to be able to function normally. It's also part of the normal process of mourning, going through the process of loss and grief. It's actually the first stage of grieving, and this is all normal. I think it's a system whereby we also delay feeling certain emotions until we are ready to cope with them. So I think in the normal sort of sense, the denial becomes this protective wall where we protect ourselves against overwhelming emotions that we face while we try to get to grips with whatever bad news that we've heard. Now, the challenge is obvious when this becomes severe. So when denial becomes severe or protracted, let's say a person in grieving never moves through the stage of denial, or when a patient completely denies the fact that they've been diagnosed or that they have a problem. Now, you will know that this is a very common problem amongst addicts, but it can also happen to people with certain diseases. Chronic diseases, diabetes, hypertension, certain psychiatric diseases. In one study, the psychiatrist said that in schizophrenic patients, denial of their illness was the most common reason that they gave for non-adherence. So we can look a bit deeper into this and also say that there are different types of denial. So denial can be simple, where we just completely deny a particular fact despite overwhelming evidence. It could take the form of minimization, where we try to downplay the seriousness of a problem. So we will accept the fact that we have a certain disease, let's say diabetes, but we would not accept the seriousness nor, for instance, the treatment. And another form of denial is projection, where we are looking for a way to avoid dealing with something. So we may accept that there's a problem, but we would rather blame somebody or something else rather than taking responsibility ourselves. So the question that you will ask is, how should I deal with this? Well, the reality is that there are positive and negative ways to deal with it. I mean, one way would be to confront it head on and to try to wake the patient up by giving them something that will make them afraid of their disease. For instance, you can say, if your diabetes is not treated, you will get a heart attack. But this confrontational way can often worsen the denial, because what you're doing is you are stirring the fear that often underlies the denial in the first place. And it was that fear that caused the patient to not accept what problem they have. So you make them more afraid and you overwhelm them with negative emotions. So confronting this head on is not a good idea. So how should we deal with it? Once again, like we said before, I think open communication is very important, where they feel that they are not judged and where they feel that they have the freedom to open up and to speak about their fears, to speak about the things that overwhelm them. And I think when that happens, when we have identified the fears, when we've identified the overwhelming emotions, then we can start with honest reassurance and helping the patient with a plan that may suit their situation better. I would encourage you to watch the video that I've made on fear and non-adherence, because that will also make you aware of many of the fears that patients are faced with. So I think in short, to summarize, let's realize that denial is a reality. All of us, whether you're a patient or whether you're a healthy person, will sometimes use denial in our everyday lives just to cope. So let's realize that it can be something normal, but we must also realize that it can be severe. And if it becomes so severe that the patient goes into a mode of denying their disease or illness and they're not taking their treatment, then it becomes dangerous. And we need to have a careful, gentle, and caring approach to dealing with that.